Hi, everyone, and welcome to today's episode of Parmjit Speaks. Today, we have a phenomenal guest. He's someone who is very special to me. We have Dr. Joseph Rosado with us today. I'm going to tell you a little bit about Dr. Rosado, and I'm going to pass the mic over to him so he could introduce himself. But this week's episode is just a very innovative episode. So this is a completely unscripted podcast episode, guys. So what that means is Dr. Rosado and I have not discussed what questions I will be asking or what topics that we're going to cover. We really did want this to be a very interactive and conversational episode. So you're going to see us in the raw having a very fluid and transparent discussion. So what is today's episode called? You guys are probably wondering. So today's episode is about navigating resilience through the confluence of both conventional and alternative medicine. And again, which Dr. Rosado has a lot of experience in. And so I just want to tell you a little bit about Dr. Rosado's experience, and then I want to tell you a little bit about how I met Dr. Rosado.
We only have 30 minutes.
Yes, I have to remember that. So 30 minutes. Okay, let me make this quick. So Dr. Rosado, he is the medical director of Panacea. And did I say that right, Dr. Rosado? I know you just told me how to say it.
Yeah, it's Panacea Alliance
Panacea. I promise I will get it.
in the
Panacea.
oldest city in North America, St.
Awesome.
Augustine, Florida.
Okay, St. Augustine, Florida.
A little bit of trivia.
I wouldn't know anything. I know Disney World, and I've lived in West Palm Beach before, and so that's about as much as I know about Florida. Panacea Alliance is a behavioral or mental health center, as Dr. Rosado just mentioned, in St. Johns County. Dr. Rosado also is an adjunct professor at Lake Erie College of osteopathic medicine in Bradenton, Florida. Did I say that right?
Yes, osteopathic medicine in Bradenton, Florida.
Okay, I promise I will get better at these pronunciations. So, so Dr. Rosado and I actually met at the Health 2.0 conference that took place here in Las Vegas here in earlier in 2023. And Dr. Rosado and I both served on a panel in which we were discussing why more women and minorities need to be included in clinical trials. So it was amazing sharing the stage with Dr. Rosado. Honestly, I felt humbled and honored to share a stage with you, Dr. Rosado. And so let's get into it. So I have a myriad of questions I want to ask you, but I think the first one I want to ask you is, so you and I got very, we got very personal, very friendly, and we exchanged, stories of, my background while we were at the conference. You shared stories of your background. And you shared with me how you got into medicine and your very humble beginnings. And uh, honestly, it just goes to show, it speaks to how resilient of an individual you are. So I'm not going to get too much into that. I will let you take this. Why don't you tell the audience, Dr. Rosado, how did you get into medicine? Where did you start?
My long journey. Okay, well, if you buy my book entitled Hope and Healing: The Case for Cannabis, which I know you have and have read it, in there I share the story of when I decided I wanted to be a physician and the story behind that and the post-traumatic stress disorder and the PTSD that I sustained and suffered as a child, as an infant,
Yeah.
just going through and dealing with conventional medicine as we know it, and my experience with my first pediatrician. And so from there, I decided that I wanted to be a physician. And knowing that, everything that I moved towards was in that direction, in that vein, for lack of a better term. And so, knowing so, I went to high school where we had a dual program. It was a work study program. So sophomores and seniors went to school in the morning and we worked in the afternoon. And then
Mhm.
freshmen and juniors were the opposite. They worked in the morning and went to school in the afternoon. Well, my first job was as a custodian, cleaning the boys' bathrooms. And dust mopping the floors, buffing the floors, and I thought, this is not preparing me to be a physician.
Yeah.
In the latter part of my sophomore year, the second semester of my sophomore year, they were offering a certified nurse's aide course.
Mhm.
And I had some friends that had been part of the first course that was done in the first semester. Well, I got there too late and I was unable to enroll for the course in the first semester, but I was able to do so for the second semester. So my sophomore year, second semester, I took this course on to become a certified nurse's aide. I By passing the class, that automatically gave me the degree and the certification to be a CNA, certified nurse's aide. And my first job as a CNA was at a nursing home, an
Yeah.
assisted living facility, um, assisting, and I was the only guy. So my job was rolling these elderly incapacitated invalids that were, octogenarians,
Yeah.
and to avoid them getting bed sores.
Mhm.
But and so it was lifting, doing all the heavy work, everything that the female nurses aides didn't want to do or couldn't do. They called me in here. I'm 16 years old,
Yeah.
being a CNA, because back then, this was 1978, you could be a CNA at 16. So I started doing that. Got really tired of all the heavy lifting
Yeah.
and the abuse from the female nurses.
Yeah.
And so I then transferred to a local hospital and was a transportation orderly, where I transported patients from their rooms to the x-ray department and vice versa for x-ray procedures. And so I got really involved with all the different diagnostics in x-ray and radiology. And back then MRIs didn't exist yet. CT was the big, the big game in town, for lack of a better word. And
Yeah.
so, I rotated through each one of the departments, and I saw the anatomy radiologically, and I would sit next to the radiologist as they were reading the x-rays or the studies, and I'd be listening and just shadowing them. But just, I'm 16, 17, 18 years old, not a whole lot of knowledge. I'm just a kid, but learning and hearing them and just hearing the medical terminology and the how they looked at things and what they were looking for, looking at different pathologies. Didn't understand them, but I was seeing them. And so that really sparked my appetite for medicine. Once I became 18, then I went on and became an EMT, emergency medical technician, worked as an orderly in a post anesthesia care unit, transporting patients from the recovery room or the post anesthesia care unit
Mhm.
to their rooms. I did that as I was continuing on my undergraduate work, became a paramedic, worked on an ambulance as a paramedic, then worked as a cath lab technician with my paramedic degree, because I was part of a pilot program where they didn't have any cath lab technicians. And so they did a pilot program where they were taking critical care nurses, respiratory therapists, um, perfusion technicians, and training us to be cath lab technicians. And I did that, and that's where my love for cardiology really took off. And
Sheesh.
learning about all the different pathologies of the heart, and going in and doing heart caths and seeing the blockages and opening those up with angioplasty, and working on valves, and without having to open somebody's chest, and
Right.
doing recovery and doing reperfusion. It was phenomenal. Right at that time, I was preparing for my MCATs, my medical college admission test,
Uh-huh.
and I was involved in a severe automobile accident where I was
Oh.
rear-ended. I was stopped,
Uh-huh.
getting ready to make a left-hand turn into a laundry to pick up my karate uniform, because I was and still am a martial artist, and I had a tournament that weekend. And I
Uh-huh.
was picking up my tournament uniform, and while I'm sitting there in my vehicle, I was in a Datsun 210. For those of us that are older, know that before Nissan existed, it was Datsun. So here I am waiting, and an individual that was 16 years old was drinking a milkshake, dropped the milkshake, bent over to pick it up, left his foot on the gas. My vehicle stopped his vehicle. He was in a Delta 88, so he won. And right there, I suffered a compression fracture in my spine. And immediately started feeling like paralysis of the lower extremities, numbness and tingling, something that you know about with your
Yeah.
multiple sclerosis,
Yeah.
that pins and needles sensation and some areas of numbness and just freaking me out. You know, I'm in my early 20s. I'm in great shape.
I was just about to ask that. Yeah. How old
Yeah,
were you at this point? Yeah.
yeah, I'm in my early 20s. This was in 87, so I was 25. Uh, so just that trauma caused me to go to a chiropractor, because after going to the emergency department and being admitted and them pumping me with anti-inflammatories and muscle relaxants, once that initial paralysis and anesthesia wore off, then I had the paresthesia, the pins and needles, and like, well, that's as good as you're going to get. You're just going to have to wait for it to resolve. So
That's not an option.
and not at 25.
Right,
So,
right.
so I went to a chiropractor that I had gone to before for a sports related injury. And he was the one that told me that I had a compression fracture in my spine and started working with me. And 2 weeks after the accident, all the numbness and tingling was gone. I had my flexibility again. I had my ability to do my stretching exercises and everything else. And that kind of lit a light bulb in my mind and saying, okay, there's something to this, this natural approach. And so I changed gears, and instead of going to medical school, I went to chiropractic school. Went to chiropractic school in Marietta, Georgia, just north of Atlanta, completed the course, took my exam, took my boards, was licensed in multiple states, and went to practice in Ohio, hated the winters, moved to Arizona, where my twin daughters were born.
Mhm.
And I was always involved in the Hispanic community, particularly being in Arizona, a lot of Spanish speaking people, uh, and working with the underserved, underrepresented kind of stimulated my desire to work with the underserved community. And that's where I realized the limitations in my scope of practice as a chiropractor. And that then took me back to my original path of going to medical school. I went to medical school in the Dominican Republic because, as you can hear, it was my sixth career. And so I went to the Dominican Republic. I had a family of four to support. And so went there, went to school, passed, took my boards, and literally the rest has been history.
Yeah. And so you brought up a lot of great points. And I kind of want to go back to a few things that you mentioned. So you mentioned that, when you got into that car accident and, you dealt with the compressed spine and you said, you were young, you were 25 years old. So do you feel that you're wanting to explore alternate treatments, natural medicine? Was that spurred by the fact that you were young, right? So because, so you and I have spoken a lot about, the things that I've gone through medically, right? And so I was diagnosed with MS when I was 24. And I did go the traditional a route of medicine, immune suppressant therapies, things like that. But like you, I also thought there has to be a better way. There has to be a better way. And this is not to say that I went the natural route necessarily, because I didn't. I went with a science-backed treatment, hematopoietic stem cell transplantation. But I knew that there had to be a better way. So would you say that your age was the reason you went that route? Or do you think that you probably, regardless of how old you were, even if, let's say, this had happened later in life, you think you would have still delved into exploring what other treatment options were available to you?
I'm stubborn, and so I
Yeah,
and
same.
and And so being stubborn has caught, my resilience is because of my stubbornness, not
Yeah.
taking, no for an answer. I was born and raised in New York City in the Bronx. You know, not too many of us at that time in the early mid 70s, which is when I was going to high school. I graduated high school in 1980. So my formative years were in the 70s. New York City at that time was not the best place to be. There was a lot of issues going on. In 1977, we had the blackout, we had the massive looting going on, lots of gang violence, lots of issues going on in the city at that time. So not too many of us from that era and that area made it to where I and a lot of my friends are presently, because many of those friends are either dead or were in prison and
Wow.
incarcerated and died in jail because, I'm 61 now. So many have died in jail or, are just now getting released from jail or, from prison rather. And so the fact that I am stubborn by nature, I could not accept this is the best we've got. This is the best that you've got to live with. That did not resonate with me at all. Just like when you were told this is the best we've got, that didn't resonate for you. And you
Yeah.
began to research and you went outside the country. And yes, even though it is a medical program and it's only done by physicians, because in one of my offices right now, Complete Wellness Medical Centers, we offer platelet-rich plasma treatments for joint injections, for musculoskeletal pain. We do purified amniotic fluid infusions. We do exosome injections and infusions, not only into the joints, but intravenously for long COVID, people with multiple sclerosis, people with fibromyalgia or
Yeah.
rheumatoid arthritis or autoimmune diseases. So even though only a physician can do them, it's not mainstream medicine. It's
Right.
considered alternative medicine. And for the same reason, because I'm tired of patients coming in, or I got tired of hearing patients telling me, oh, my doctor said there's nothing else for me. No, it's not that there's nothing else for you. It's that they have nothing else to offer you. Doesn't
Yeah.
mean that there's nothing else for you. Just like in your case, there was more for you. Unfortunately, the physicians that you were seeing had nothing else to offer because they didn't have the training or the belief, because that's another issue. What do they believe? And medicine is an art, a science, and a philosophy. It's not a religion. It's not something
Right.
you believe or don't believe. You know, and so the art of it and the science combined with the philosophy of doing no harm, first and foremost, is where you want to incorporate all the things. And so it's just been other tools in my toolbox. So when somebody comes into my office, I have chiropractors, I have acupuncturists, then not only do they see me, but they see the chiropractor, they see the acupuncturist,
Yeah.
because it's a multifactorial project and program.
Yeah, yeah, absolutely. And so it's so funny that, you talked about, being from New York City and, having this attitude that, no, I'm not going to take this. This is not the only option. And because you're stubborn. I would say the exact same thing about me, right? So like I grew up in Jersey and I think you and I connected on this as well, being from the Northeast. I definitely, I would say I'm feisty. I'm definitely feisty. And so somebody telling me I can't do something, my attitude has always been, oh yeah, let me show you. Let me show
Mhm.
you that I can do this. So I love that. And so and you're right. I did, yeah, go out of the country. And so, we definitely have explored other options that have not taken no for an answer. And I'm also glad that you mentioned that um, the doctors didn't necessarily have anything. There wasn't that there weren't any other options available to me, right? As a patient, it was that they did not have any other options. And so I kind of want to touch, so speaking about that, I want to talk a little bit about communication, right?
Sure. Yeah.
So Dr. Rosado, so something that you and I have discussed, I've shared with you my frustrations, right? With so number one, I'm a healthcare advocate. I'm a patient advocate. I think one of the things that has been lacking within the healthcare space is effective communications, right? And actually, I think that's lacking all over the
Mhm.
world, whether it's a business relationship or a personal relationship. Effective communication is so important, and I think that is sometimes lacking with physicians or with doctors. I can't tell you how many times in the past I've had conversations with my neurologist or my podiatrist or whomever, and I didn't feel that I was being listened to. So, can you talk a little bit about, because you're a great communicator, and one thing about you is, I think when you and I first met, I was humbled, having met you, and I was so blown away by how down to earth you were, and how down to earth you are, and how easy you are to speak with. Can you speak a little bit to why it's important for providers to be able to communicate with their patients, and why it's important for patients to be able to communicate with their providers?
Well, medicine has its own language. Like when people ask me how many languages do I speak, I tell them I speak three. I speak English, I speak Spanish, and I speak medicine because it's a language all to itself.
Yeah.
And when someone comes into my, just yesterday, perfect example. One of the therapies that I offer in my mental health, behavioral health center is ketamine assisted psychotherapy for people that have treatment-resistant depression, post-traumatic stress disorder, depression secondary to chronic pain, suicidal ideations. And
Hmm.
so I was having a conversation with a family because they did an intervention with one of the family members, a young man in his early 30s, going through pretty severe depression. None of the medications that he's already been given are working. And so they're looking for alternatives. They believe in holistic approaches and everything else. And because psychedelics are still not legal in the state of Florida, the next best thing that I can offer them would be using the ketamine to kind of reboot their brain.
And
And so
can you share, doctors, also for the audience members who are unfamiliar, what constitutes as a psychedelic?
psychedelic, the magic mushrooms is the classic example of a psychedelic. In the 60s and late 60s, early 70s, LSD was the big psychedelic at the time. And there's a lot of clinical trials and studies being done utilizing psilocybin, also known as, like, which is the active ingredient found in the magic mushrooms, LSD, etc. Revisiting that and realizing that there is a lot of value in those substances in the treatment of depression without the adverse effects and side effects of conventional antidepressants. So we're having this conversation, and I'm explaining to them how this medication works on receptors in the brain, parts of the brain that kind of reboot the brain. And I use the example, it's kind of like doing Control Alt Delete in your brain. And
Hmm.
I'm breaking it down in terms that they can understand. Well, the mom says to me, well, I've got a chemistry major and, I've got a college degree. Um, Granted, not at your level of education, but can you explain to me more scientifically? I'm like, sure.
Yeah.
Ketamine works on as an NMDA inhibitor, a receptor inhibitor, working primarily in the lateral habenula, and it stimulates the production of glutamate. And then I shut up. And then And so she's like, oh my God, what? I'm like, exactly. It reboots your brain. It's control of delete. So yeah, I can speak that medical and go there as I do with my colleagues when I'm training physicians. But at the same time, it's important for me to convey the message because if I were to hit a young 30-year-old who is a farmer who works, with goats and cows and chickens and is growing his products and is living off the land, and that's what he's been doing for the past 8, 10 years, and I hit him with, well, it stimulates the lateral habenula. He's like, the what?
So it needs to
Like,
be in layman's terms, right? Something that even a
yeah.
5-year-old can understand.
And so when I was in chiropractic school, one of the books that I was encouraged to read by a mentor was a book entitled Irresistible Communication. And it's a book specifically designed for healthcare professionals to teach us how to communicate with individuals. And a lot of it was in and around the philosophy of neurolinguistic programming, of being
Mm-hmm.
able to connect with people, not only verbally, but non-verbally, being able to match, mirror, pace, the person, so that way the person feels comfortable that I'm letting them in and they let me in, and creating that leverage and that bond and that relationship. Then from there, I read Tony Robbins' first book, not Unlimited Power, where an entire paragraph, an entire chapter was dedicated to neurolinguistic program because he's an NLP master. And so learning and then doing a lot of courses, additional communication courses. I did a lot of courses in Scientology, communication courses in Scientology, where they use a lot of techniques. And so all those different studies brought me to my ability to be on stage and touch 500 people at one time and be able to feel connected with everybody. Because the largest group, that my first largest group that I spoke to, was a group of 300 people that were healthcare professionals. Right after that, I went to Fiji and spoke into a room of attorneys, judges, prosecutors, 500 attorneys, judges, prosecutors in one room. None of them were medical.
Yeah.
And I'm speaking on the topic of medical marijuana, something that's completely illegal in that region of the world. And
Yeah.
at the end of my conversation with them, because it wasn't a lecture, it was a conversation that I engaged with them, a good third of the people came in after the fact and were prepared to start changing laws and rewriting constitutions, because they realized, wait a minute, this belief is no longer serving our community.
Yeah.
And
Yeah.
to create that kind of a shift in somebody's belief and psyche and mindset takes a lot. And
Uh,
it's the ability to connect and communicate.
Oh, sure, sure. Absolutely, absolutely. And this is actually a perfect segue into the elephant in the room, medical marijuana. So, so Dr. Rosado, I definitely want to talk about this because I think this is something that you have continued to be an advocate for. This is something that you practice when you work with patients. The use of medical marijuana to alleviate pain and treat other ailments. So I do want you. I would like you to talk a little bit about that and I know, I know you probably got a lot of resistance, right? So when you start, because I know it's such a taboo subject, right? I mean, I talked about the use of medical marijuana in a talk I gave, I want to say maybe 8 years ago. My time frame might be off, but anyway, I remember I talked about medical marijuana to a group of healthcare professionals, and this was when, again, medical marijuana wasn't talked about as much. So talk a little bit about why you went that route, and then what is maybe some resistance that you got.
Absolutely. Well, it's another tool, as I mentioned earlier, it's another tool in my toolbox. And as I've evolved in medicine, everything that I've learned, everything that I've gathered are just additional tools, because one size does not fit all in
Right,
medicine.
right,
And what works for you does not work for somebody else.
correct.
And even within the medical cannabis space, just because one chemovar, aka strain, works for you doesn't necessarily mean it works for somebody else. I have twin daughters. They're 27 years old.
Hmm.
And what works for one does not work for the other. They both use cannabis, but one uses one thing and the other one uses the other something else that's completely opposite. And if they mix and match their medication, it's going to make one paranoid and the other one ultra depressed. And so we got to shift it. So it's just another tool. But one of the things that really stimulated and drew me to it is the fact that we all produce cannabis. We have what's called an endocannabinoid system. With endo meaning within,
Uh-huh.
cannabinoid meaning that works on the receptors in our body. And so we all know about the respiratory system, the nervous system, the cardiovascular system, the respiratory system, but no one or not too many people have learned or know about the endocannabinoid system. Less than 10% of medical schools in the United States, and I would venture to say the world,
Uh-huh.
have no clue and do not teach. I'm sorry, less than 10% teach about the endocannabinoid system. The majority do not. And so, for that reason, learning that we produce cannabinoids in our body that work on those receptors. The first endocannabinoid was named and discovered in 1992, so it's relatively young.
Uh-huh.
And the first name was that was given to the endocannabinoid is anandamide, coming from the Sanskrit word ananda, which means bliss.
I did not know that.
And so it is the bliss cannabinoid. And so we have receptors in our body, in our brain, in our spinal cord, in our white blood cells, in our bone marrow, in our gastrointestinal tract, on our skin, where cannabis works. And so adding cannabis to our system to maintain balance, or what we call in medicine homeostasis,
Mm-hmm.
having that balance is what allows us to be free of dis-ease, lack of ease. It's not disease. You separate the word disease into dis-ease, lack of ease. And that's what we suffer. We suffer with lack of ease. And by creating a balance that allows us to be blissful.
Wow. 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 So every time we speak, I swear, I learned so much. You give me so many nuggets of wisdom. So yeah, so I wanted to definitely talk about that. So really quickly, and I know we're coming to an end, but you know, as I had mentioned to you, Dr. Rosado, I was diagnosed with glossopharyngeal neuralgia. And we're talking probably around 2017 timeframe. And so I was diagnosed with glossopharyngeal neuralgia. And for folks on the call who don't know what that is, glossopharyngeal neuralgia is basically like the sister of trigeminal neuralgia, which is coined the suicide disease. The reason it's called the suicide disease it is because it is so painful that folks want to, for lack of a better term, they want to kill themselves. And it basically, to describe what it feels like little electric zaps. It feels like someone is zapping your brain and your throat with just a little electric shocks. So every few seconds. So if you can imagine that, or if you remember, and some war crimes included shock therapy, and because it is that painful. And so anyway, at the time, I was prescribed an anti-epileptic medication. And while the anti-epileptic medication did reduce my pain somewhat, unfortunately, what it did on the opposite end is it made all of my MS symptoms, even though I've been in remission for many, many years, it made all of my former MS symptoms act up. And so, whereas it takes me 20 minutes to do my makeup, all of a sudden it was taking me 2.5 hours to do my makeup because my hands weren't functioning, my balance was off. And so anyway, I knew I needed a different option. I was like, this isn't working. This isn't working. This is just no way to live. And so anyway, somebody told me about CBD oil. So CBD oil, and said, you know what? Since you're in pain, to alleviate your pain, why don't you try taking CBD oil? And initially, admittedly, I was reluctant. I've always been such a buy the books person. And so I thought, there's no way I couldn't.
But CBD is legal, it's over the counter.
Right. Yeah, exactly. And so yeah, I took the legal over the counter CBD oil, and it worked. It relieved my pain.
Do you know
And
why?
why is that?
Okay, so let's talk a little bit of anatomy.
Okay.
So glossopharyngeal comes from the cranial nerve 9, which is the glossopharyngeal nerve. Okay, we have 12 pairs of cranial nerves. And so the way we remembered them was a mnemonic, O, to touch and feel a girl's vagina, ah, heaven. Yeah.
Oh,
But the the vagus nerve is cranial nerve 10, trigeminal nerve is cranial nerve 5, which you mentioned, trigeminal neuralgia. Tri meaning 3 is a nerve that gives sensation to the forehead, the cheek, and the jaw. And one of my medical assistants suffers with trigeminal neuralgia. She has a burning, lancinating pain in her face all the time.
Yeah.
She's a medical cannabis patient, and it alleviates the pain. Glossopharyngeal is cranial nerve 9. It's the nerve that innervates, goes to your throat, your larynx, your vocal cords. So when there's an issue with that, it deals with the taste of the bitter taste on the posterior 1/3 of the back third of your tongue. It works on the vocal cords, etc. And so when there's an issue, you can tell that people have a sense of being hoarse or having like a hoarseness. Every once in a while, I'm sure when you speak, you sound like you've got like a raspiness, more
Yeah.
like a very sexy, raspy voice, kind of like. But all that in the peripheral nervous system, which the cranial nerves are part of the peripheral nervous system, they have CB2 receptors.
Okay.
CBD works on the CB2 receptor, which is why CBD worked for you. The reason why CBD works so well for children with epilepsy is because one of the main causes of epilepsy is a problem with their vagus nerve, cranial nerve number 10, which also has CB2 receptors. And so CBD works on those receptors, and it helps control the 200 to 300 seizures that a lot of these children suffer with. So for
Wow.
that reason, that's why it helped you, because we have cannabinoid receptors on our nerves, and the CBD works on those receptors, which helped ease your pain and restored your balance, addressing the chronic debilitating disease that we all suffer.
Wow. 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 That is incredible. That is incredible. Always dropping knowledge on us, Dr. Rosado. Okay, well, so I wanna wrap up. This has been a great conversation, Dr. Rosado, and I'm glad that we didn't rehearse any of it because this was just a great conversation, and I think you have brought so much value to this episode and to my audience. And so again, I want to thank you, Dr. Rosado, for your intellect, your wisdom, and for all the work you continue to do in the healthcare field and all the different patients' lives that you continue to change. So thank you so much for being here.
It's my pleasure. And I will end this interview as I end all interviews with hashtag cannabis is medicine. It is
Hashtag cannabis is medicine.
it is not a gateway drug. It is a drug that frees us from the grips of dis-ease, lack of ease, and allows us to walk away from a lot of medications that have a lot more adverse effects that down the road can cause dependence and or addiction.
Absolutely.
And on our
Absolutely.
next episode, we'll talk about that.
Absolutely. Absolutely. I would love to have you again. Well, Dr. Rosado, again, thank you so very much. Enjoy the rest of your day, and we will speak soon.
And Happy New Year.
And Happy New Year to you. And Happy New Year to everyone listening. Bye.
Bye-bye.